Sun exposure, the effects on the human skin. Sun exposure defined. Sun exposure is the rays given off by the sun that can help and be harmful to humans. These are known as ultraviolet rays, or UV rays. There are 3 different types of UV rays: UVA, UVB, and UVC. Even though you can't see UV rays, they go through the outer layer of your skin known as the epidermis. The epidermis layer contains cells that have pigment called melanin, which is how you tan or how you show your freckles. A sunburn is characterized by cutaneous erythema appearing 24 to 72 hours following sun exposure. The cause of a sunburn is excessive exposure to UV radiation, commonly causing acute transient inflammation in the skin. Most common types of sun exposure. UVA rays are the most common types of sun exposure. Tanning beds, mercury lights, often found in stadiums and school gyms, and some types of lasers. UVB rays are less exposure but more intense. The rays are responsible for skin cancer and sunburns. UVC rays are the worst. Luckily, we are not at risk thanks to the ozone layer. Risk of sun exposure. Throughout the USA, the incidence of skin cancer and its related mortality have been increasing at a precipitous rate, including tripling of rates among individuals of light complexion. Currently, skin cancer is diagnosed in 1 in 5 Americans and accounts for nearly 10,000 deaths annually. Hell's itch is a dermatologic reaction that can occur from sun exposure and is often characterized by symptoms such as intense pain, itching, paresthesia, and suicidal ideations. Symptoms of abnormal health skin. Symptoms of abnormal health/skin. A patient described Hell's itch as a dozen of white-hot sewing needles being repeatedly stabbed into my upper back. The pain is so unrelenting and unbearable, it drives me completely insane. Other symptoms are heavy sweating, thirst, burning, itching, elevated body temperature, red skin, and blisters. You can even sunburn your lips. When to see a doctor. Ask your doctor about regular screenings to look for early signs of cancer. You can check for new and changing skin spots at home. If you notice anything unusual, contact your doctor immediately. Spots may hurt, itch, or change color, texture, and shape. Skin can be removed by a doctor to do further testing for cancerous cells. Questions to ask your doctor. At what age should I start using sunscreen? How do I know what SPF sunscreen to use? How much sun exposure is considered healthy? How do I know if a skin spot, like a mole, is abnormal? How much is too much exposure? A few signs can determine whether you've had too much UV rays. Noticeable change in skin appearance, such as lumps or moles, early aging, lower immune system, white blood cells won't protect your body as well. Eye injuries, such as blurry vision, issues with your cornea, and blindness. Skin cancer, melanoma is very aggressive and severe. Know your skin and what you can handle. Everyone is different. Types of skin cancer. Basal cell carcinoma, or BCC. This type of skin cancer almost always occurs on sun-damaged skin and is usually pink, shiny, and raised. Because of the skin becomes very soft, it may be easily injured and may appear as a scab that keeps returning in the same spot. Dr. Blizzard identifies the basal cell carcinoma. Other types of skin cancer. Squamous cell carcinoma, or SCC. This skin cancer is also caused by exposure to the sun that can occur in burn scars from either heat or radiation treatment, or from chronic ulcers of the skin. In a small number of cases, SCC can spread to the lymph nodes and rarely to other organs. Dr. Blizzard says that these can vary in severity and may require special surgical treatment, such as Mohs surgery for removal, if they are larger or difficult to treat in areas. For the third type of skin cancer, malignant melanoma. Melanoma is the least common type of these skin cancers, but is increasing every year, especially in young women between the ages of 18 and 29 because of the high rate of tanning bed use in the population. Melanoma is very dangerous and can occur in any place where there are pigment-producing cells, include the entire skin. It does not have to be in the direct areas of sun exposures, but sun exposure can increase the risk. Moles, birthmarks, in the eye. It can spread to lymph nodes and beyond to other organs, including the brain, lungs, and liver. Melanoma is much more common in families with a history of abnormal moles or malignant melanoma. Those who have had melanoma have a significant risk of developing other melanomas, so Dr. Blizzard recommends regular skin checks. Pros of sun exposure. Sun exposure can help reduce obesity. People are more likely to go outside and be active when it is bright and sunny out. It can enhance your mood, treat seasonal depression, relieve stress, improve sleep. Small amounts of UV rays are good for us. The body thrives after absorbing. It's good for vitamin D. According to the World Health Organization, WHO, UV rays can help treat some health conditions. Doctor might order it for people who have eczema, psoriasis, rickets, and or jaundice. UV rays can be used to disinfect or sterilize. Cons of sun exposure. Sun can damage the eyes. It can cause heat exhaustion or heat stroke, sunburn, heat rash, skin cancer, and can even cause you to age faster. How to improve skin health. Use sunscreen. The higher SPF, the more protection you have. The FDA advises using over an SPF 15. Apply 30 minutes before going into the sun and every 2 hours while you're in the sun. Get the overlooked areas such as the ears, lips, and hairline. Avoid being outside for long periods of time between the time of 10 a.m. and 4 p.m. This is when the UV rays are at the highest. Give your skin a break. Wear clothes and hats that protect you from UV rays, and do not use tanning beds. Keep in mind, some medications like birth control and antibiotics are making your skin more sensitive than usual. Pregnancy can also wear down the barriers of your skin and cause you to burn easier. Rays can be stronger when reflected off of things such as water, metal, concrete, sand, and snow. You can even get burnt when it's cloudy outside. Products to improve your skin health. Water and sweat-resistant sunscreens, zinc oxide or titanium dioxide in sunscreen is less irritating on the skin. SPF 15 or higher. Sunscreen without bug repellent because it may reduce the effectiveness of sun protection if applied together. Lotions are better than sprays, and UV filtering sunglasses. And these are just some examples of things you can wear or use to help covering yourself in the sun. Just because you wear long sleeves or a hat in the sun does not mean it's going to be hotter. It just means your skin will be safe.